Hey everyone, this is Derek with OPTP, and welcome to our second installment of our Next Level content series presented to you in collaboration with EIM, or Evidence in Motion. For those of you just joining us for the first time, this Next Level content series is intended to do two things. One, educate, and two, inspire, mostly clinicians to take their career and their quality of patient care to the next level. And today, we're going to be discussing functional dry needling, which represents a great opportunity for clinicians to, one, improve outcomes for their patients, and two, take their education to the next level. So we've got a great individual with us today who are going to have talk to us about functional dry needling, Edo Zylstra, who is a lead faculty at EIM. He also had a company called Kineticore, which got acquired by EIM back in 2016 and kind of rolled into the functional dry needling offerings at EIM currently. So, Edo, thank you so much for joining us today.
Yeah, thanks for having me. This is great. Appreciate it.
Yeah. So when we let's get right into the discussion here. Our first question is going to be, what inspired you to specialize or focus in functional dry needling techniques?
Yeah, good question. Kind of fortunate. First job coming out of PT school in 2001 was with a company in Colorado that was really integrative. Christopher Centeno was kind of my mentor for the first 4 years of practice, but day one in the clinic, I was already being exposed to dry needling. And they started training me. I then went on to do more advanced training throughout Canada, US, and other places, and just fell in love with it, mainly because of how you can interact with the patient through this great tool, but also the responses. It's taught me a lot about how to be a better clinician, because it's not just about a needle, but it's the why behind it. Why are we utilizing it? What theoretical model do we utilize? And that's why we're a functional model, which we can get into further if you want. But it's just, if you integrate it well, you become passionate. I know a lot of clinicians that we've trained that have now gone on to have their own private practices, a lot of cash-based practices, and really set themselves apart because of the success that they're having utilizing this tool, but also more of the theoretical model behind the tool.
Okay, cool. Just out of curiosity, do you know roughly how many clinicians have any experience in functional dry needling, or what percentage of clinicians might offer some type of service to patients?
So it's interesting. So when I first started, there were less than 10 of us doing dry needling in the US. From our training, there's probably just under 20,000 we've trained over the last almost 20 years. And then with just dry needling in general, I bet you we're close to 40 to 50,000 people that are trained in some way, shape, or form throughout the US.
Wow. Yeah, I'm just trying to understand what the opportunity might be for a clinician as well, and setting themselves apart from other clinicians, right? Because the next question we have is, how does learning about functional dry needling help clinicians take their career and patient care to the next level? So
it's a great question. I don't want to go down too many rabbit holes, but you have to have a good justification for why you do anything clinically, particularly when there's more risk, right? So manipulation and dry needling are probably two of the things that people would consider have greater risk. And in doing so, we have to recognize, okay, well, why are we doing it? Dry needling, in the sense or in the model that we teach, is a tool to reset the neuromuscular system. We're impacting more of the nervous system than anything else, but we're also seeing increases in blood flow and changes in tissue health. But it allows us then to reinforce that change. So we utilize it as a diagnostic tool. We use it to treat pain, but moreover, we're utilizing it to reset that neuromuscular system so that we can have a greater change to reinforce. So in the clinic, it allows me to not focus really on how many visits we're going to see a patient for, or walking alongside them as they're healing, but we're really trying to take away barriers of healing and reinforcing those changes that we make so that they heal faster. So most of our clients in our clinic see us 4 to 5 times for most diagnoses, and then they're on an as-needed basis. So how we utilize it is, I think, really important, because it's based on the why behind it. It's not looking at someone just through biomechanics or the lens of biomechanics, but it's what is happening with the nervous system, what's happening with the tissue health, how can we impact that? And we're learning still a ton about various things that are impacted, like calcitonin gene-related peptide. It's a big word, CGRP, but it's the main chemical that is being manipulated by migraine medications. We know now with needling that we're actually impacting the presence of that to allow for greater vasodilation so the tissue heals better or more quickly, because ischemia is not a good thing for tissue. So as a clinician, to improve patient care, I think dry needling is one of those great tools. I think being a good manual therapist, having manipulation, mobilization, but then also having good correctives and understanding how to utilize corrective exercises, all within a kind of a pain science understanding as well, which is, again, really important when you're dealing with patients that have discomfort and pain, because that's why they see you.
Sure. Yeah. So what's one of the most profound stories, a patient-centered story, where you've seen this technique dramatically impact someone's life? I'm sure you've got a lot of them, but what's one that sticks out?
Yeah, so I would say there's a couple, particularly in the realm of headaches. I personally, I kind of specialize in the cervical spine and head neck stuff, and I have seen, I could count on well, not on hand, but I could throw out probably 20 to 30 different episodes of care where someone had multi-year headaches, and like daily or weekly headaches, and within 3 to 5 sessions, they no longer have headaches. The most profound one was a recent 11-year-old kid who started having headaches after 2 bouts of COVID, was really deconditioned, ton of coughing, missed probably 60 plus days of school, thousands of dollars of testing and medication and all of this. And within 3 sessions, we had reduced his headaches to like a 1 out of 10 every couple of days, and then got him into an appropriate training program. And I see the kid occasionally, and he's still doing great. He's back to doing what kids do. And honestly, it was like 2 sessions of needling that actually got him symptom free. And then it was all the other things we do to reinforce that change. So really cool story, 10, 11-year-old kid, really greatly impacted.
Yeah. Yeah, I love doing these interviews at this part of each interview where I ask about a story, because this is where all you guys get super hyped up, and it's so cool to see the passion come through. It really is. I mean, my wife is a physical therapist as well, and I mean, the passion behind the occupation and the reasons why people do what they do is really amazing. But anyway, a little sidebar there. But next question: describe what it's like to attend one of the FDN courses. Whether or not, well, maybe first, if you could highlight through EIM what courses are available, what education opportunities are available, I guess, and then what it's like to attend.
Yeah, so we have courses throughout the year. We'll have 100 plus courses probably this next year. We have level 1, level 2. We have a clinical integration course, which you can take after level 1 anytime. And then we have an advanced clinical integration course, which is after level 2. And it's meant to be a very advanced approach. Most of our courses, you're going to find something close to you wherever you are in the United States, or at least a short flight away. They range from a 2-day to a 3-day model of courses. The 2-day course is very technique driven with very little clinical integration, just based on time. So you're learning all the muscles that we have set up. So our course is set up to have an introductory and then a little bit more of an intermediate or advanced course with our level 1 and level 2. Our level 1 course are muscles that are throughout the body, that allow you to have a really good repertoire of muscles, a good list of them that allows you to manage most diagnoses. But we deem them very safe because you're learning a new invasive tool, and oftentimes you're thinking so much about the mechanics of it, just this new tool, that we want to make sure that we're pulling any risk off the table. And then once you have that experience, taking level 2 becomes very easy. The courses themselves, you have a bunch of online content prior to showing up. You get to see all the techniques that you're going to do in the course prior to the course, so you get the visual reps. And then on the course itself, we review some of the theoretical stuff, the why you would needle, to determine, how you're gonna use it in the clinic, and then we practice all weekend. So I just taught this last weekend in Champaign, Illinois. a 3-day course, and the amount of reps that you get by the end of the course is significant. And the question I always ask, usually halfway through day 2, is like, how do you feel now? Yesterday not being able to needle to today. And most people are like, I can't believe that I'm able to do what I'm doing. And I feel really confident and comfortable. My job is to make sure that you feel comfortable, confident, and safe and competent, right? To apply this Monday morning in the clinic. And if I've not done that and you want to learn that, then I have failed. And so all of our instructors have that same push of, we really care about this technique, and we know that if you learn it but then don't use it, it really doesn't matter. And it, yes, the theory and the why behind it and just understanding the nervous system and all of that can impact your clinical care. But, again, we want to make sure that this is a tool that you're able to use after our course, and that's how our courses are set up.
Okay. Well, that's amazing. Yeah, and we'll direct traffic to how they can learn more about the courses in just a second. But we've got one last question.
Thanks.
That's how many years have you been in the PT world, PT space?
Yeah, so I'm into I think I've been in 23 years. So I graduated December of 2000. So yeah,
Okay.
So this is my 24th year.
Okay, so through those years, if I'm sure you've got lots of advice for people coming into the profession or just starting in school, but what's one key piece of advice you give to either a new PT or someone interested in becoming a PT?
Yeah, you're right. I have a lot of advice because I'm an old guy now. Honestly, I'd say know what you're getting into. So like why you're doing it, what you're getting into, what is it in physical therapy that you can be passionate about? And I wouldn't say specialize early, but understand if you're going to be inpatient or out, if you want to work more neuro or orthopedics. But I would say the biggest thing, the greatest success is understanding everything you're learning in PT school through a clinical lens. So like your anatomy, understanding your anatomy through a clinical lens, not just learning the data, but how does it apply to human function? We're supposed to be movement experts, and that, everything we learn should then apply to understanding human movement. And I think we're getting better, but I don't think we're experts yet. And understand too, it's a profession that you're going to learn the rest of your career, which to me is what keeps me, invested in it. I want to continue to learn. If I'm not learning, I'm just coasting, and it doesn't go well with my personality. So,
yeah, and that's honestly a large reason why EIM and OPTP decided to collaborate on this is to keep the ball rolling, so to speak, with regards to education, because it just helps everyone, the clinician and the patient.
Absolutely.
So, yeah. Well, where can people go to learn more about the functional dry course offerings?
Absolutely. So evidenceinmotion.com has all the information you need. You can also contact me if you have questions. Just go EDO, so Edo at EIMPT.com. Happy to chat. That's the cool thing about Evidence in Motion, even though it's a larger Con Ed company and company that teaches, entry level PT on the university side to post-professional. We're still very small, business oriented with regards to how we interact with people. So, we want people to have a great experience and have no regrets. So we try to keep things very transparent up front, with regards to getting involved. And, I would say with any education, plan on working, plan on putting the effort in. I know on our courses, you're going to put effort in, but if you do, the result is really good. You get that exceptional response typically.
Yeah, well, definitely that all that information is very much appreciated. I've been onto the EIM website, super easy to navigate and find all the courses. I see all the ones that you're teaching along with some of your colleagues. Man, you guys are doing a lot too, and you're traveling a lot.
A little more than I want, but yeah.
Yeah. Well, cool. Thanks so much for your time. Thank you everyone for sticking around for the entire interview / discussion. And any final words, from you?
Yeah, I guess not really. Look forward to meeting any of you guys. I'll be around at CSM. That's coming up soon. Or if this is after CSM, hopefully we got to chat.
Yeah. Yep. OPTP will be there as well. And if you're watching this content after, you can always check out optp.com as well. for all your PT product needs, and also to learn more about the EIM OPTP collaboration. So thanks again, Edo, for your time. Thanks everyone for joining us.
Yeah, thank you.
We'll see you next time. Thanks.